Hey everyone, it's Michael here with Home Health Success Academy and 10xpatientreferrals.com, and welcome to another video in our home care series. And this right here gets asked a lot of us. Now, we definitely help agencies with marketing and at the same time as starting up their own home care company. But this is one of the questions that comes up a lot, and that is, how do I prevent the high turnover rate of our caregivers? And that's one of the biggest problems a lot of agencies face is losing caregivers, right? Here they are, they have a client, they found a caregiver, they assign them to them, and they're providing services, and all of a sudden that caregiver leaves. Or at the very same time as, they lose a caregiver before they can even, provide care. Or they can't actually just find caregivers at all. All right, so what we want to be able to do is address these things. And there's pretty much 5 main reasons of high caregiver turnovers with a lot of agencies. And just want to let you guys know, if you're facing this type of problem, you're not the only one, okay? So even with my agencies, for example, we try to do a good job by addressing these 5 things to make sure we reduce it, but it's still going to happen. You can't please everybody always, okay? There's no such thing as always. So the first thing is that we hear a lot when we did a survey, and actually there's also another survey done by Homecare Pulse. So there's a lot of similarities that we saw from some of our surveys with theirs as well. And so number one is poor communication, right? I'll tell you guys one thing. For my companies, we like to say that we are an HR-driven agency. And so we believe in having communication. And so sometimes is when somebody gets hired and we assign them to a client, we just let that go. The only time we connect with them is when we not want them to be able to do some training, or we connect with them, in regards to something about their payments or hours of operations. And so we don't want to be able to have that. A lot of workers want to feel like they're involved in an organization. They just don't want to hear that, once a year holiday party or any of that stuff. So we make it a habit where our team, for our non-medical private duties, the administrator will send out a video message to all our employees. It's not that hard at all. And every 2 weeks, we also will send a quick 3-minute hello video to their phones that's personal to them. We want them to know that, hey, we know that you're not in the office, but we know you are out there in the field with one of our clients, and we want to be able to say that we totally appreciate you. And so nothing beats good communication. And communication goes both ways, meaning that not just us in the office or the owners to the staff, but at the very same time is allowing them to be able to communicate directly to you. So one of the things that we make sure we implement is we're using, for example, a cloud-based software system to take care of our patient care and to put information in there. It also allows all the staff members to communicate easily so that they can send us a direct message. They will also have a direct line to either my cell phone or through the administrator's cell phone as well. We want them to say that, hey, feel free to let us know what you're feeling. We don't want them to hold any grudges. We don't want them to be holding any discourse at all. We want them to be able to say, hey, speak up your mind. We can't solve everything. We cannot always go on your path or your side of things, but we definitely want to be able to let you know that we hear you and that we actually support you and we want to acknowledge you. So that's number one, is poor communication is a big reason why a lot of people have turnovers. The number two is they feel that they don't have support. Now this is a quick short one, but I've seen it a lot where, unfortunately, because the client is paying for our services, a lot of times it's companies will side with the clients, and it's not always where the client is right. And at the very same time, it's not always that we need to side with the clients. And so, we've seen it, for example, where, a patient, for example, becomes a little violent or maybe verbally abusive. And we sometimes just tell our caregivers to just suck it up or say, well, that's just a normal thing. No, it's not normal. And we should not allow any workplace, abuse such as whether it's verbal or even if it's physical, especially, of course, sexual. Now, so, you want to be able to give support to your team. You want to be able to give them support. Another part of being supportive is to be able to say, hey, we see that you worked a lot of hours the past month. Do you want to cut back? Do you want me to find somebody to replace you to give you an extra 10 hours this week? What can we do to give you support? Another thing that we provide support is this. Is that once every 2 weeks or so, or I'm not gonna say every 2 weeks because even my companies falter in this part. But what we'll do is we'll send a care package to our caregivers. We're going to give them a call all of a sudden and say, hey, Are you hungry? Do you want some food? What kind of food do you want? And what we do is we just use Uber Eats because, we wanted to have something delivered. And so we'll have food delivered to them, just for them, not for the patient, for that caregiver. And you'll be surprised, the $10 cost of us or $15 cost for us to pay for something such as that, to pay for food and say lunch is on us, means so much to those caregivers, right? It just really means a lot to them. And that's our main goal, is to be able to give them that opportunity to say, hey, we're here for you. We support you as much as possible. Okay. The next thing is the third, and this is actually probably, one of the biggest reasons why a lot of caregivers has turnovers is, if they're not getting communication, they're not getting support, and then all of a sudden, the third one, which is they don't get paid enough. Well, guess what? You definitely will be getting a high turnover. And so, if you have a caregiver, if you're offering services and you're paying them $10, guess what? If another caregiving company comes along and say, hey, we have a client and we're going to pay you $12, I'm guessing that caregiver is going to leave you guys really, really fast to move on to get paid by $12, company. And so, the reason why, unfortunately, a lot of caregiving companies, a lot of agencies pay less or pay low is because they unfortunately bill low, they charge low. And so when you're billing a client, when you're trying to compete on price, and the truth is this, there can only be one agency that's the lowest agency, and anybody who tries to stick with the pricing war and try to go lowest will always lose, because you don't have room for growth. You don't have room for any emergencies, right? So you have to understand that when you bill low, you can only pay low. And sometimes when you pay low, more likely you're going to get the lower totem pole, the lower quality caregivers. I'm not saying that the lowest paid caregivers are worthless or are bad, but at the very same time is, if you're paying them a decent wage, then a person's going to be a lot happier and will more likely provide better service, better care, and be more mindful of their clients, because they appreciate their job and they appreciate the work, the company they actually work for. So you have to start paying attention to even your pay. If you say, for example, are seeing that the average pay in your area is $12 an hour, then you better step up the game and say your pay is going to be $12.50 or $12.75. Now, there's a lot of agencies out there, unfortunately, that will have a range of pricing structures for their services. They're going to say that we probably charge more if the patient's more difficult, or we're going to charge less if the patient is less difficult. Well, the truth is this, though, guys, you're still going to pay your caregiver the same exact thing. You're just trying to find a way to be able to make more money for your company, right? So you have to understand this, is that you shouldn't do that, right? My goal here is to be able to provide great service at a great price, but at the same time is pay my team, really good. And the reason for that is because when I have a client that comes in, the last thing I want to have is a problem staffing them, right? So if I can actually have a good pay for a caregiver and they want to keep their job and they know that I provide them support and they know that I have good communication with them, they're going to want to be able to stay with my company, okay? So the fourth reason why there's a high turnover caregiver rate is, unfortunately, people want to be trained and they sometimes feel that they're not ready. How that works is, we try to hire people that already are nursing assistants, right? That's one of our main goal. But at the very same time is, we do hire some people that don't have experience as a caregiver or as a homemaker or even as a nursing assistant. And so one thing we need to be able to provide them training, making sure that they're actually ready to go in the field. And just because somebody is a nursing assistant, that doesn't mean that they know what to do at the home. So you must give them proper training and orientation. Now, there are some states that require their caregivers to be nursing assistants, or there are some states that require that a company provides some form of training or minimum hours of training for the caregivers. Now, knowing that with some states are being